Good morning, good afternoon, good evening, depending on where you're joining from today. I'll be taking you through my leadership project titled Strength in Difference, a holistic support model for women caregivers and their children through limb difference. So, hello, my name is Mariam Johari. I am a medical doctor and public health specialist, currently serving as the country director and NEST 360 country liaison for Tanzania. NEST 360 is a global alliance currently working in 5 African countries to end preventable newborn deaths in Africa. Of all the titles I hold, the one that I hold most dear is that of mother. Motherhood has really shaped how I lead, how I listen, and how I show up. My lived experience is the inspiration behind my leadership project to really reimagine and reshape how African health systems serve children born with congenital limb difference. So, a bit of statistics 4 to 6 of 10,000 babies born are born with congenital limb difference. Proximal femoral focal deficiency is a type of congenital limb difference in which the upper part of the thigh bone is either malformed or missing completely, causing one leg to be shorter than the other. The incidence of this is 1 out of 100,000 babies are born yearly with proximal femoral focal deficiency. It's important to note that these statistics are drawn from Western contexts, underscoring a major gap in African specific evidence. At 5 weeks postpartum, with just 1 week left before returning to work, and after extensive advocacy for my daughter, I finally received her diagnosis of congenital proximal femoral focal deficiency. I encountered a health system at that time that was broken and unprepared from the lack of specialized expertise, the absence of coordinated care, and limited information left me feeling overwhelmed, anxious, and carrying deep fears. So, my leadership project, Strength in Difference, or SIDE, aims to establish a holistic support model in Tanzania, journeying side by side with children born with limb difference and their caregivers. This model consists of 3 components. Firstly, the Holistic Support Hub, which aims to be a one-stop center with qualified physicians, specialized nurses, physical therapists, mental health professionals to really provide complete and holistic care for the children and the parents that are navigating this journey. Secondly, the Nguvu Circle, which is a support group providing a safe space for caregivers to connect and share, just really reducing isolation, stress, and that decision fatigue that sometimes caregivers get. And finally, the development of context-specific resources that aims to support children and their caregivers and to really help build children's confidence and development. These will be age-appropriate educational materials in the form of stories or videos that support key developmental transitions, for example, early childhood, school age, adolescence, helping build that self-esteem. We anticipate that this will lead to the generation of actionable evidence, which will then influence policy and help redesign health systems. Currently, stakeholder mapping and early stakeholder engagement has been completed, and from the different conversations with stakeholders, they all show a very strong resonance with this project. The main challenge currently has been the catalytic capital that is needed to move this from concept to implementation. And finally, reflections from the past year. So, what have I learned this past year? I've learned that being vulnerable is not a weakness, rather a strength in my leadership. It's not about having all the answers, but asking and continuing to stay curious and having the courage to begin. I carry this work forward in the hope that my daughter and countless others will grow up knowing that, in the words of the daily affirmations that my daughter and I say every day, that they're enough, they're unstoppable, and they are brave. To the caregivers who sometimes feel like they're carrying the weight of the world on their shoulders, know that you're not alone. Lean into your village, whatever that may look like. Keep advocating for your children. Keep asking questions. And if you're told there's no path, trust yourself enough to build one. And finally, to you, dear listener, if any part of this has resonated with you, if you have thoughts, reflections, or ideas on strengthening the model, I invite you to connect with me and keep the conversation going. Thank you so much for your time.